Dr. Amit, it is a very pleasant uh, uh, thing to do today is to talk to you. As we age, our uh, uh, teeth also decay and age. So there is something going in the market that dental crown implantation. So what are dental crowns?
So dental crowns are custom fit caps. They are made to put in the areas where it's deeply cavitated, or where there are implants. There is a discoloration of the tooth. So if it's non-restorable with the fillings, then we go ahead and do the crowning on these areas.
In what other conditions dental crown needed?
So dental crowns are needed in the areas where there is a big cavity, there's a fractured tooth. Only thing is, fracture does not have to extend to the root portion. Then there are dental implants, there are bridges. There's a missing tooth and you want to make a bridge, so you can put two crowns here and then a tooth in between.
So what are the types of the crown which are available these days?
So there are ceramic crowns, there are feldspathic crowns, there are zirconia crowns, there are lithium disilicate crowns, there are porcelain fused to metal crowns. These crowns will be placed in patient's mouth according to the desired results, according to the functionality of the patient.
Can you brief me how you go for a dental implant procedure step by step?
So when patient walks in our dental clinic, first thing is we're gonna do a thorough consultation. We're gonna see how big is the cavity, if there is a cavity, how big is the crack, if there is a crack. If there is a crack, then we will recommend patients to get the CBCT then. CBCT is cone beam computerized tomography. It's a scan to look for the cracks. It is a three-dimensional image. So we do that, then we do IOPA, intraoral periapical x-rays. We check patient, and if the tooth is healthy, periodontally, means tissues are healthy around, and if tooth has got big cavity, so if it is reaching towards the heart of the tooth, which is pulp, then we do the root canal, do the filling, and do the capping on top of that. So that is step one. Step one is we do the consultation. Step two is we give anesthesia if needed to the patient, do the crown prep. Step three is we give them a temporary, and before that we do a 3D scanning, impressions, whatever. If some people have the scans available in their office, then they do the scanning. If they don't have 3D scans, then they intraoral scans, then they do the impressions. That's how we do, and then we give them temporize. We send it to the lab. Then the waiting time these days have reduced quite a lot. So it is 2 to 3 days. But if somebody has CIREC milling unit in their own office, then the crown is delivered within an hour.
So there is, I think, quick questions. Usually people ask when they are planning for a dental crown. One is, how long do dental crown last?
So that's a question which it depends on the functionality. Usually the crown lasts from 5 to 15 years, but if patient is a heavy parafunctional habit, heavy bruxer, and then the survival rate of the crowns is little lesser, they will not last for 15 years. And if patient has very got poor periodontal health, then they have a lot of recession going on in their mouth. In that case, they are more prone to recurrent caries and all those problems. Recurrent caries is the gums go down, their food, they get a lot of food deposit, and then the caries happen again. In that case, they'll have to take the older crowns out and then redo the fillings and get the newer crowns done in their mouth.
So does the crown tooth have to be specially cared for? What is the care for the dental crown implant?
So we have to follow the regular protocol of oral prophylaxis, which we do: flossing, brushing, professional cleaning by the dentist. But as far as dental crowns is concerned, you have to take extra care, because there is a definitive margin, or there is a, if you see, there is a junction between the tooth portion and the crown portion. So you have to be more precise in your cleaning, so that there is no micro leakage there. So to prevent the micro leakage, you have to floss better, you have to use water flosser, you have to do mouth rinses. So whatever it is, you have to take better care of your crowns.
It's also a myth that the dental crown hurts.
No, it doesn't. It's done by a very well trained professional. It saves your tooth and it gives a very good long life to your tooth. It's a very beautiful procedure.
If somebody doesn't want to have a dental crown, what other alternatives are available?
So they can have inlay onlays, which is they don't involve the buccal and lingual full contour crowns. So we do it upper 1/3 portion of the tooth structure. So we reduce there and we give onlays and inlays. So those are the alternatives. There is another thing called veneers. Those are the cosmetic thin layer. It's like a what we give for laminates for the nails. Similar is those are the laminates or the veneers for the tooth. So those are usually used for the cosmetic procedures. We can use it as an alternative to crowns also. That's a very good alternative too.
How long is the recovery period of the dental implants?
To be honest, if you see my office, patient walks in, we give them temporary crowns immediately after the procedure. They are comfortable. So for us, that there is no recovery period. Patient is as good as has a new crown within an hour. We give good, nice temporary crowns within an hour.
Last but not the least, can a patient replace his old crown with a new crown?
Absolutely, yeah. When you see there is a micro leakage, or there is a discoloration in the crown, or there is you see some margins are getting black, that is the time you have to take a call. You want to go, your dentist actually has to take a call. If you go for a regular visit to your dentist, he's gonna see those discolorations happening or blackish margins appearing. In that case, he will decide to replace your crowns. But if you don't go to your dentist regularly, you have to take a call yourself.
Thank you.
Thank you.
Achha,